Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. In this segment, we're going to be talking with Jodi Parker in our ongoing series about the GO2 Foundation's collaboration with Merck on their patient awareness initiative called Worth the Fight, taking on lung cancer. And Jodi Parker is with us today. She's a cancer advocate and a patient who's living with advanced lung cancer. Joining us on the program to talk about her journey and her involvement with the Worth the Fight initiative. Welcome to the program, Jodi Parker.
Thank you, Neil, and thank you for this opportunity.
Well, give us a bit of your background. What is it that you do? What is it that you did before your diagnosis, and what are you doing now?
Okay. Well, I'm 58 years old. I'm married. I have 2 children. I have 3 grandchildren. I was a registered nurse up to the time that I got diagnosed. I had 10 years of oncology nursing, so working with cancer patients. And then I did about 22 years of, I was a director over case management and social services at a level 2 trauma center in Idaho Falls, Idaho. Okay. My journey started back in December of 2012. January of 2013, when I thought I had a bad cold. I had a cough that wouldn't go away. I had shortness of breath, and I thought I just had a bad cold. So I ended up going to the doctor, and they prescribed some antibiotics and an inhaler and some steroids, and I took the full course of that. And it didn't help. In fact, I got worse over a period of about a month. I went back to the doctor and they decided to do a chest x-ray, and they found that I had a large pleural effusion, which they ended up draining. And it was the fluid that they got the diagnosis off of. I was completely stunned. They put me in the hospital because I was having a lot of pain from the procedure that they did to drain the fluid. Yes. They were running all kinds of tests. And the fluid, after 2 days, came back positive for non-small cell adenocarcinoma, stage 4. I met with the oncologist for the first time, and he gave me less than a year to live.
Oh, devastating.
It was very devastating and a complete shock. And how can I have lung cancer? I was young. I was healthy. I had never had any medical problems. And so as a previous oncology nurse, I knew that having stage 4 lung cancer was not a good thing, and that the outcome was usually quite grave. And I had a meeting with my family, and I told them that I only have a year to live. I want to have the best quality of life that I can, and I don't want to go on any treatment, and I want to go on hospice and just live the best that I can for the remainder of time that I have. It was at that time that I had a friend who was also a physician who called me and asked how I was doing, and I told him what my decision was. And he said, well, I hear you, but I want you to listen to me. You're 52 years old. You're otherwise very healthy. You're in the prime of your life with your job. You have a loving family. You have 4 grown kids that are in the prime of their life, marriages, grandkids, and I want you to just think about that. And I got off the phone, and I thought, he's right. I do want to fight this. It's worth fighting. And it was that phone call that changed my mind. And I decided that I was going to do everything in my power to beat this and to fight and do all that I can. So my oncologist put me on chemotherapy. I was on chemo for a year. And then some other treatment options came along, and I did that for 18 months. I was on a particular medication, and then at that time I developed 2 brain tumors.
Oh.
I ended up going back I went to surgery. They removed the 1 tumor. I had radiation, and during that time, they had approved another medication that I ended up going on, and that medication is what I'm currently on now.
Your brain tumors, were they related to your initial cancer diagnosis, or was that something that was happening on its own and just occurred during your initial treatment?
No, it was related to the lung cancer.
Okay.
Lung cancer, unfortunately, either most likely goes to the brain, bone, or liver. And so the 2 brain tumors were actually metastatic from the lung cancer.
Okay. Now, you've become an advocate. Let's talk about what's going on with you now and about Merck's collaboration with the GO2 or GO2 Foundation for a patient awareness initiative.
Mm-hmm. Okay. Yes, I have been contacted by the Merck campaign initiative, and I've been working with them. This is an initiative that's focused to empower people with advanced lung cancer, along with their loved ones, to take active roles in their cancer care, and to not be afraid to talk to their physician about various options. And I've made the habit of every time I go to my oncologist for an appointment, I bring someone with me, and I write questions down that I have prior to going in. So that just helps me keep organized in my mind. The initiative is it wants to get the word out there. You know, there's often a stigma that goes along with lung cancer that only smokers get it. But in fact, non-smokers get it as well. And no one deserves to have lung cancer, smokers, non-smokers. And anyone is susceptible to lung cancer. If you have lungs, you can get lung cancer.
Is there anything that you look back on when you were first diagnosed that you would tell yourself if you could, and what would that be?
It would probably be my experience as an oncology nurse was 35-ish years ago, and that there's been a lot of research that has taken place between now and then, and that there are various options that are out there now for lung cancer, and for people not to get discouraged when they hear that they have a diagnosis of stage 4 lung cancer. It's not the end of the world. There's options out there, and that it's important that we continue promoting research and advocating for research, also advocating for federal funding for lung cancer. Lung cancer is one of the least supportive of all cancers, and I'm a big promoter for promoting for lung cancer research.
Can you give our listeners a place where we can learn some more about the initiative and about Merck?
Yes, they can go to the website of www.fightlungcancer.com, and this is where they can learn more about the initiative. They can download a discussion guide to help them and their loved ones to have an informed conversation with their doctor about treatment options, and to find additional support services. My story is also on that website, so they can go on there and read about my story. It's just been a great support for me.
Jodi, I appreciate you coming on and speaking with us tonight here on Health Professional Radio.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Jodi Parker, cancer advocate and patient living with advanced lung cancer. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.